As for the treatment of deep caries, there are two options. We may treat deep caries in one visit, but bottom should be dense, light or pigmented, or in two visits. The bottom may be with areas of softening. Treatment of deep caries in one visit. We provide anesthesia, the next dissection of caries cavity till dense, light or pigmented bottom. Next, antiseptic treatment, drying, and apply therapeutic or subbasic gaskets. Next, insulating gaskets, zinc phosphate or polycarboxylate or glass ionomer cement, and the last one, permanent filling. There are three types of treatment lining or pads, and it depends on the mechanism of action. First type is odontotrophic, contributing to the formation of substitution of dentin and contain the preparation of calcium. The second type is biological. It has antimicrobial and anti-inflammatory action. And the third type is combined, which has antibacterial, anti-inflammatory and also plastic modifies properties like odontotrophic. Mechanism of action of calcium hydroxide. Calcium hydroxide is a strong alkali with a pH of 10 till 12 points. At the site of application, there is necrosis in the pulp. Next, the pulp is impregnated with calcium salt from the bloodstream, and dentin tubes are sealed, and odontoblasts form a matrix of substitutive dentin. Materials containing calcium hydroxide is produced in different drugs form. Aqueous suspension of calcium hydroxide may be powder and water. They ovulate only under a temporary seal no more than 1 or 1.5 months. Next, calcium salicylate cement like Life, Dical, Calcimol and others. They are used under a permanent seal and represented by a paste-paste system. Two pastes which are mixed and apply on the bottom of the caries cavity. And light curing of polymeric materials containing calcium hydroxide. They added a light curing polymer resin, and they are durable and can be used under a permanent seal without an insulating gaskets. Just this paste, next light and next adhesive system and filling. The representatives Septocal LC by Septodont and Calcimol LC by Roca Light Curing LC. Biological and combined therapeutic pads contain corticosteroids, salicylates, antiseptics, chlorhexidine, sodium hypochlorite, antibiotics like metronidazole and polymyxin, different enzymes like trypsin, hematrypsin. They overlay on the entire bottom of the cavity for a short time. Willing to combination medical pads. They are pulpamyxin, pulpanest, pulperil, pulpavital. Mechanically fragile, not hardened. They are replaced by calcium-containing zinc eugenol cements. By the mechanism of curing, therapeutical pads may be chemically cured, and there are two components: basic paste and catalytic pastes. They have high bacteriostatic effect due to high pH from 10 till 12 points, and they don't form micropores. And the second mechanism is light curing. They are one component paste. They have good adhesion to the composite through the polymeric matrix and high compression and transparency. As for disadvantages of therapeutic pads, there may be the formation of denticle and petrificates, which leads to obliteration of the tooth cavity. There may be formation of denticle and petrificates. Next option of deep caries treatment in 2 visits. During first time of patient, we provide anesthesia, maximum necrectomy, anti-inflammatory and antimicrobial drug using biological or combined therapeutic pads for several days, from 2 till 7 days under the temporary filling. The most point is temporary filling, and during the second visit we remove on temporary seal, provide antiseptic treatment, point odontotherapy drug, therapeutical drug. Next, insulated gaskets and permanent filling. In second visit we may fill cavity using permanent filling. The imposition of calcium-containing therapeutical pads is pointwise in the projection of the pulp horn in one point close to the pulp horn. It will be enough, only point. Another option which will be provided in 2 visits. In first visit, incomplete necrectomy. Next, odontotherapy, the drug for several months, from 1 till 6 months, and also temporary filling. And in 1 from 6 months, during first visit, we provide electro-odontodiagnosis. If it's in the norm, we continue treatment of deep caries, providing anesthesia, complete necrectomy, point odontotherapy drug, insulating gaskets, and permanent filling. Difference in the duration of this odontotherapy. In first option it will be several days. In second option it is about from 1 till 6 months till half a year. And the lecture is over. Thank you for attention.